Sounds good.
Hi, and welcome to the virtual vendor event of Inland Empire. And we have KeithRN here. And so I'm going to let them go ahead and start their presentation.
All right, I'll go ahead and introduce. I am Keith, the founder of KeithRN. I'll be joined with Maria Flores Harris, our nurse educator consultant. But just want to just briefly introduce, KeithRN really began 14 years ago as a passion of mine to bring about the needed transformation in nursing education by, again, making learning active and developing clinical judgment competency based on the work of Dr. Patricia Benner from Educating Nurses, a radical transformation that was published in 2010 when I was a brand new educator. And, really our passion is to really teach nursing the way it's actually practiced. And by prioritizing practice readiness and preparing our students to successfully transition to real world practice, the NCLEX will take care of itself. And so we use unfolding authentic case studies based on Tanner's framework, using open-ended responses to practice the thinking of practice. And now Maria is going to share some of our solutions that nurse educators have found very helpful. And I also would just kind of highlight too that one of the things that separates us from other vendors is that I create resource through KeithRN and our consultants to, again, equip educators with the best possible teaching tools that students can also access at no additional cost. So Maria, I'll let you take it from here.
Okay, thanks. Hello, everyone. I am going to go off camera so that you can focus on my voice, what I'm saying, and what you're seeing on screen, and not a talking head. Um, so let me just, where is my, well, maybe I won't. There we go. There we go. Stop video. I know sometimes having a talking head can be a little distracting, so I prefer not to do that. You have two modes of transmission, and that's what Meyer says is best. So again, I'm not going to say anything more other than I am Maria and I am a nurse educator, and I'm happy to be here to present to you on our two main offerings at KeithRN. One is Think Like a Nurse membership, which is what you see here on your screen, and the other is our um, bridging, uh, complete bridging our practice, bridging. My goodness, I don't know why I'm having trouble with that. I've said that 100 times and now I can't say it, but bridging teaching and practice clinical course. So those are our two main offerings, and I'm going to start with TLAN. And I'm going to probably talk a little fast. I'll try to slow down. I am from the South, so I do usually talk slow, but I know our time is limited, and I just want to highlight some of the offerings that we have. And so I will go through it rather quickly, but you have a recording, so you can always go back and catch it. This is, as I said, our Think Like a Nurse membership that you see on our screen. As Keith said, this is for you, faculty, and students will use it at no additional cost. And I think if I had to say one thing about TLAN, I would say this. It really is a comprehensive clinical judgment solution for your program. And the way that we do that is with case studies mainly, and active learning tools and templates. And we also have some faculty development and student resources. I want to highlight each one of these, and I'm going to highlight our case studies first. They are authentic, unfolding case scenarios that are derived from practice, and we have over 300 of them with over 100 topics. So they span the curriculum. You'll notice that we do have them categorized here by traditional and concept based. As Keith mentioned, they are built entirely on Tanner's clinical judgment model, which is a practice informed model, but it aligns perfectly with the National Council State Boards of Nursing clinical judgment model if that is a model that you use. I am going to open one of these case studies and just highlight again a few things. We do have different levels. This is our skinny case study. We have what we call skinny and unfolding. Don't let the name fool you. As you will see, for some reason I'm having language difficulties today, so I apologize for that. You will see that even with the skinny, it does unfold a little bit. But what I wanted to highlight here is we have a full answer key for you, the faculty. so you don't have to worry about not having the answers. You also have a PowerPoint here that you can share, that you can project in the classroom or wherever you are using the PowerPoint. And then, as Keith mentioned, students will use this at no additional cost. And the way that you give them access is to simply give them this link and password. And the students will get access to this. This is the embedded template of the case study, but the students also get access to a downloadable template. It is a writable PDF. So students can, of course, print it and do paper or pencil, or they can fill it out electronically and send it to you. I just want to highlight a few things in our case study. Let me make this maybe a little bit smaller. All of our case studies do begin with a little prep activity. So this is a great ticket to class or wherever you're going to use it. And of course, we highlight, we have a patient, but here's what I want you to notice that's different. This is what I'm going to do, is to just point out our differentiators. We have open-ended questions, as you can see here, very purposely done that way because we want to mimic practice. You don't walk into a patient's room and have a patient say to you, "Hey, Wendy, I think A, B, C, or D is going on here. What do you think?" You have to figure it out, right? And we want you to be able to see your students' thinking in these clinical scenarios. We provide vital signs on a Dynamap, just like you would see in practice. You will see that students have the ability to listen to heart sounds and breath sounds and interpret those. We have great images. One thing that I will mention as I'm going through here and you're looking at these questions, I'm just trying to scroll so that you can see, but also not make you sick. But one thing that you will see as we go through these questions is we're using the same framework of questions because repetition builds thinking. And we want students to repeat this type of thinking by answering these same questions in every case study. You're seeing there the lab work, very much presented like you would see in a chart. A lab planning activity. This is basically a small care plan, mini care plan built around the most common lab values for this problem. And now we get into our medical management of the patient, our discharge planning. Now remember, this is a skinny, but here is the part that does unfold a little bit. So the student is getting new data and they're evaluating the patient, more lab data there. And then we end all of our case studies with reflection because reflection is a key part of building clinical judgment. Now, let me show you the difference. That was a skinny. This is the same case study, but it's an unfolding. And again, I just get, for sake of time, highlighting the differences. It is the same patient because students are able to practice spacing and retrieval if they're dealing with the same patient, the same concepts. But we do have progression of complexity here. You're going to notice that this unfolding case study, again, open-ended questions, but you're going to see more questions, you're going to see more complexity. Here are our what I call our caring questions. These are holistic questions where we basically want the student to stop and think they're not just caring for a patient, they're caring for a person. And they need to, the only way to get students to really be intentional is to ask that question, to have the students stop and think, how are you going to make your patient feel important to you as a person? So those are our caring questions. Again, you see the Dynamap. You see ability to auscultate breath sounds and heart sounds. You see the images there, pitting edema. Now we've added a rhythm strip here in the unfolding. You've got your radiology reports, your lab reports. I probably need to slow down and making some of you sick. Here's our lab planning activity, but you're going to notice that we've added a couple more labs. Okay, so a little more complicated. This is a heart failure, renal failure patient. So do students really understand what creatinine is and why it's important, BNP, and why is it important? And that's there very purposely because we know students love to memorize lab values, but they may not really understand what those lab values mean. And now we get into our medical management again of the patient, but here you're going to notice we get a little deeper into pharmacology. So we have some dosage calc here. We have priority setting. So not only do they need to tell me why they have those physician's orders, they have to prioritize those physician's orders. Problem recognition. I'm going to stop here just for a moment. This is a very purposeful section as well. This is about failure to rescue. You guys have seen it in the literature. We nurses fail to notice when something starts to go wrong. So in the unfolding, we're going to have this section so that students will stop and think, what complication could occur? What data do I need to be watching for to see if that complication occurs? And what am I going to do about it as a nurse? That's such an important topic there. We have our education discharge planning with our interdisciplinary question there. And then here you're going to notice with the unfolding, there's a lot more here to unfold. We have SBARs because this patient is declining and the physician needs to be called. And we have more unfolding data and the student has another SBAR because the patient is going to be transferred to ICU. And then we end with reflection. So again, I apologize for the brevity there, but I hope that you do get a sense for how the skinny and the unfolding are different and differing in the level of progression of difficulty. Now, I also want to mention that with all of our case studies, we have a rubric, and this is a game changer to me. We all have evaluations for clinical, for SIM, but do we have rubrics that we are consistently using in the classroom? This is a way to use a rubric with every case study that you do in the classroom. So now you're using evidence-based practice because you're using case studies and you have a rubric to show that you're building clinical judgment in the class as well. That is the rubric based on Lassiter's clinical judgment rubric that has been out there now for, I know, over a decade, used very often in SIM. And this is the scoring sheet that goes along with that rubric. You will notice that students will get a score in every level of Tanner's and an overall score. And you also have a place for you to provide feedback to your student. So what I want to say about TLAN in our case studies is that no, it's not a test bank. No, it's not NCLEX prep, but it is helping you build a framework that you can embed across the curriculum with those case studies and with these tools. Now, what I did, I'll just show you. I'm back on the membership. Everything I just showed you was right here in our case studies. Now I'm moving here to our tools. And of course, we have dozens and dozens of tools. I'm just going to highlight a couple just to give you a sense for what those look like. This is our patho tool. This is, if you want to think about it, pathophysiology is foundational, right? It's foundational to nursing. So if we think about Bloom's, this is the bottom of Bloom's. This is the foundation. What we've done here is we've taken patho and we've contextualized it to patient care, like Patricia Benner told us to do in 2010. A lot of students do what I call the get it, spit it, forget it method of study for patho. It's a prereq, it's a co-req. They get it, they memorize it, they put it out on a test, and they forget it. What we're doing here is showing students that if you connect patho to that primary medical problem of your patient, you can explain patho in your own words to your patient, then guess what? You know what body systems are affected, and you know what your priority assessments are and what your lab values are going to be. We're making the connections for the student with patho and how important that is. And again, foundational. Now I'll show you a second document that's available in the TLAN membership. I've gone up to the apex of Bloom's now, and this is where students would generate their own data. This is called Create a Case Study. It's basically a reverse case study. So you would give your students the background for the patient, and they would give you the vital signs that they expect, the assessment they expect, the lab values, so on and so forth. And also, there's basically a mini care plan at the bottom with those clinical reasoning questions. So now that you put this case study together, tell me what your primary problem is. Tell me what your nursing priority is, and your care plan. So again, those are just two examples of paperwork, of tools, active learning tools that are in the TLAN membership. Now, if I go back to the home page here, I'll just show you, for sake of time, I'm not going to go in and open these up, but we do have 38 NGN case studies, Next Gen NCLEX case studies that unfold but are very condensed. They only have maybe 4 to 7 questions. And basically, what we've done here is we've taken those bow tie and trend questions and have deconstructed the thinking in each step of the clinical judgment framework. So when students are asked a question on NCLEX, they know what type of thinking is involved in those questions. And then you'll also notice that we have some NCLEX test item writing here. We provided a few item writing guidelines and a template, an EMR template, so that you can write your own questions. So I like to point that out because I know that NGN is it's big, it's important, and we do have some tools there for you and the students. And what I will say again is this is not kind of a teaching to the test. It's helping students build the practice informed thinking that they need to make those multiple choice questions on NGN very easy. And then finally, here I want to mention the faculty development. So not only is this a platform for you to use with your students, but it is a platform for you to use to develop your abilities as an instructor. We have 40 plus hours of CE on the topics that you see here. I think some very cool topics like incivility and professional identity, of course, clinical judgment, writing test questions, learning science. All of this is asynchronous. You can watch the video in your own time and you get an evaluation at the end of the video with just maybe 2, 3, 4 questions. You fill it out and your CE certificate gets sent directly to your email. And there's one last thing that I want to point out here. And I point it out because I think it's a little bit hidden, but it is such an important tool. In our student teaching videos here in Improving Student Success, we have a complete student success course. This to me covers everything. It covers growth mindset, self-efficacy, resilience, test anxiety, time management, learning science, reflection. It really covers everything. These are short videos for the students to watch. We even have several chapters in our Think Like a Nurse workbook for students that is available here for the students to read through. And then we have downloadable tools as well that the students can use. And again, you share all of that through a link and a password. I think what's so important here about this is that most programs will try to fix students after they fail. And this course really prevents failure by teaching them how to think, study, adapt, and recover before failure. So that in a nutshell is the Think Like a Nurse membership. That really is our flagship, if you will. Now, the next offering that I want to show you is this Bridging Teaching and Practice clinical course. This course was built for mainly new educators and adjunct educators. But what we found is that many people that have adopted this program want everyone to take it because even seasoned nurses can pick up on, innovative new tools and new activities. So this course really, as I said, was built with adjunct faculty in mind because so many of us have so many adjunct faculty and we have a hard time keeping them on the same page. And many adjunct faculty are also new to education and don't have that foundation. So this solves your onboarding problem. As I talk, guys, I'm just going to scroll really slowly so that you can see the different parts of the course as I just kind of highlighted overall. But what you'll notice is that this course solves onboarding and training for new adjunct faculty. It standardizes clinical instruction and paperwork around clinical judgment. And it gives practical clinical day execution tools and scripts and question frameworks and even feedback and evaluation templates. As you'll see, it's 20 concise, sequential, interactive, and I'll go in and show you that, interactive lessons. There is CE credit for each lesson. You have anywhere from 0.5 to 0.75 CEs with a total of 13 CEs. It also aligns with the CCNE expectations for BSN faculty preparation, and it aligns with the clinical certification exam. So if you're interested in that, we have the crosswalk here to show you that we align with the blueprint for that exam. And then we have a complete toolbox that I'm just going to open up and show you before I go into a lesson. There are over 50 different tools in this course that you can download and use as an instructor with your students. And this is just a full list of those tools. So I like to just highlight that for you. Obviously, I can't go in and open 50 tools, but I am going to show you a couple. But this just gives you a full list in one place so that if you are in the course and you want to just go easily find a tool, you can always come here to your toolbox and see all of those tools. Now, what I will do next is, before I highlight a tool, is just let me go back and open one of these lessons. I'm just going to open this here just to show you what these lessons look like. We designed the course using structured sections, as you're going to see here, collapsible drop-down elements. We have strategic call-outs, relevant visual supports. We did all of that to manage cognitive load so that we could enhance the learner's comprehension and not have so much distraction. Okay, so you will notice that things are sectioned out very nicely. We have some pause and reflect. We even have some questions that are embedded. We have a full video summary by the author. So a quick video summary that tells you what this is about, what this entire lesson is about. And then we have a full audio transcript. So if you want to listen to this like a podcast and listen to it while you're in your car, while you're walking, you have the audio transcript of all of this information. So it is the full lesson. And then, of course, we have tools that you can download and use. So this is the toolbox, but it's the toolbox, parts of the toolbox that are relevant to this particular lesson. So that is what all of the lessons look like. I want to show you, highlight, as I said, just a couple of tools, just like I did with TLAN. The clinical judgment concept map. This is a very popular tool for clinical judgment paperwork. You guys know that a concept map helps students visualize their understanding of clinical data and its connections. And this concept map really helps students identify what is relevant and important, prioritize nursing care appropriately, and evaluate the patient in 2 pages. Okay, so that's just an example of one of the types of clinical judgment paperwork. We do have more clinical judgment paperwork. So if you're not quite ready to go to a concept map in 2 pages, we have some paperwork that's a little bit more comprehensive than this. This is another template. This is a constructive feedback template. This is something that I get asked about a lot when I do a demo. I've had several people say, do you have anything to help me give students feedback? Especially if you're a new instructor. You've never done that before, maybe. You've never had to give anybody constructive feedback. So this template is designed to help clinical educators in providing constructive, thoughtful feedback to students, and they can provide it in a structured and supportive manner so that the feedback is clear, actionable, and is going to promote student growth. And you'll notice that even at the end, we give an example script for difficult conversations. And then actually, those were the only 2 that I was going to highlight. For sake of time, I think I'm doing good on time here. I will end with this and just say that again, TLAN, Think Like a Nurse, and the clinical course support the intentional alignment of clinical judgment competencies across your program. So across didactic, across lab, and across clinical settings. So with that, I think we have 5 minutes left for questions, and I do want to open it up to questions, and I'm going to just go back maybe here to the clinical course and to TLAN and just say, do you guys have any questions? Did you see anything that you want me to go into?